Hi, everybody. Let's see, I'm just checking here. Make sure everybody's in. Well, we'll be watching the waiting room as we start and let more people in if they show up. So I'm Matthias Kolmanen, and I'm a board member here at Art FM and the host of a show too called the Oldie Timey Radio Hour on WXOX. And it's my privilege to introduce the speaker for our next session, which is called COVID-19, the Future of Radio and Our Responsibility to Fight Misinformation. Well, before I do, I need to please join me in thanking our sponsors who recognize that grassroots radio stations are more important than ever to a global listenership in distress, and they recognize the importance of college and community radio. I'd like to call your attention to our sponsors now: Pacifica Network, SCMS Broadcast Equipment Solutions, Spinitron, Broadcast Tool and Die, and Mad Pixel Art and Design. So thank you to them. They helped make this possible. Our next speaker is the renowned Dr. MarkAlain Dery. Dr. Dery is an infectious disease physician and epidemiologist who has been on the front lines of COVID-19 from the very beginning. Dr. Dery has over 23 years of experience with infectious diseases and has been a medical responder to global catastrophes such as Hurricane Katrina, the 2010 earthquake in Haiti, and worked as a clinical field epidemiologist for the World Health Organization during the 2014 Ebola virus epidemic in Sierra Leone. Dr. Dery is currently the Chief Innovation Officer at Access Health Louisiana, which is the largest Medicaid providing clinic system in Louisiana. Incredibly, Dr. Dery is also the founder of a low-power community radio station in New Orleans dedicated to human rights and social justice. I just found out it's been running for 6 years. If you're in New Orleans, WHIV LP is at 102.3 on the FM dial. So we're super excited to have Dr. Dery here today at the Grassroots Radio Conference. And so please join me in giving him a warm round of virtual applause. And I'm going to hand it over to him or somehow. I'm going to unmute you. I don't know.
Yeah, sorry. Thank you so much for that. I'm going to share my screen here. And it is a privilege, really is a privilege and honor to be here speaking. I remember the first time I went to the Grassroots Conference when it was, I think, in Ames, Iowa, I think. And I always tell the story that it felt like my moment in that video with the little girl who's dressed like a bumblebee. I think the song is by a band named Blind Melon, and she doesn't find her people until the very end of the song when she finds all the other bumblebees. And I tell that story pretty regularly as to when I realized, when I got to the Grassroots Conference and I found my other bumblebees, I found other people who think like me. And so it's been a pleasure to be part of this community, and it's been an honor to actually be able to now speak to you guys about something that is very near and dear to my heart, which is COVID. I'm an infectious diseases doctor, and I did have the honor to be able to name WHIV. Like I often say, the first letter was fixed, so I needed 3 letters, and HIV were the appropriate 3 letters for me to pick, especially as an HIV doctor. We've been on air, as Matthias says, for about 6 years, going on 6 years. We went on air on World AIDS Day, which is December 1st. In 2014, and as soon as we went on air, I left for Sierra Leone, and I was gone for almost half a year doing Ebola work as an Ebola physician. So the radio station really kind of built itself with an army of volunteers, about half of which are musicians rather, and the other half are New Orleans activists. That's why we call ourselves New Orleans Voice of Dissent. But we are really based on human rights and social justice, and WHIV really adheres to principles of pacifism, atheism, and also we promote social, economic, environmental, and racial justice. And that's very, very strongly our ethos. So with that being said, let me go ahead and get started. I really wanted to talk about what the future of radio and what does a new normal look like in COVID, because I'm being challenged. I've had to step away from WHIV again for a second time. The first time was Ebola, the second time was COVID. And I can't thank my board of directors enough, and I can't thank all of the folks that volunteer at WHIV who are, which are 80 plus, like I said, who really are the ones that really keep the reins and are managing the station moving forward. But I am being challenged by my board, and I founded the radio station with my wife, and so I'm being challenged by my wife as well as to what do things look like moving forward. So what I wanted to do is kind of put together kind of what are the thoughts in my mind. I was asked to actually speak about really talking about how to maintain your radio station in the time of COVID. So we'll definitely talk about that. But from a public health perspective, I wanted to talk about what population dynamics of transmission of the virus are, and this is where we're going to talk about how to keep your station clean. But the next theme is looking at the failure of federal leadership in the management of COVID-19 and how this led to a second epidemic, which is a plague of misinformation. And I think it's our responsibility as broadcasters to fight that, and I take that very seriously. And so I will talk a bit about what WHIV has been doing as a result of that. And then lastly, I don't know if you guys know, but I'm looking out my window right now, and we have a storm happening here in New Orleans called Delta. This is our 6th storm. And I am being challenged again by my board to really question what is the role of a physical radio station that floods regularly. What does that look like, and what is disaggregated content delivery look like in an age of COVID or post-COVID? So those are the conversations that we're going to have today. So, but before we do, I'm an epidemiologist, and I would be remiss without talking just very, very quickly about what the epidemiology of COVID is looking like. This is my first of 2 plugs, so I will do 2 plugs today. So this is my first of 2 plugs. We do, myself and Doc Griggs do a daily live Facebook show called Noise Filter, and then we also have a podcast called Noise Filter that's up on the audio port. That'll be the second plug. But the first half hour of the show, it is 4 p.m. Central Standard Time, and you can find it either at the link at Dr. MarkAlain Dery or Eric D. Griggs. And for the hour, Doc Griggs and I talk about what I'm about to give you, a very shortened perspective of what the epidemiology looks like of COVID. And then the second half hour is we cover what the topics of the day are with this. You know, of course, in the last week, we've been obviously talking about the president in his case of coronavirus, and we're helping to explain to the viewers on our Facebook show, you know, what's really going on from a perspective of 2 physicians, and my belief that I think he's personally, I believe he's a lot sicker than he's letting on. But let me just quickly just kind of go over just what does it look like? What does coronavirus look like globally? We're at almost 37 million cases of coronavirus with over 1 million deaths. So I just want to be very clear that both the WHO is very clear, and last week released a statement in conjunction with another really excellent study that showed that we're looking at likely 10% of the globe has probably been affected by a coronavirus. So if we look at a number like 7.6 billion, we're looking at probably that 760 million people have been affected. So this is a gross underestimation. But what we can talk about that again is also a gross underestimation is the number of new cases that we saw last night. So this data, it comes from a website called Worldometer. That's what I use regularly. Other people use Hopkins. They're both fine. But last night we added almost 167,000 cases, and then deaths 2,328. So what does that look like? So let me just also show that this is a slide of the globe, and you can just see the whole globe. The redder the color is, you can see the more cases there are. And you can just see all of Europe is on fire, all of the Middle East is on fire, and we're starting to finally see Africa light up. We've been very, wondering why Africa has not been lighting up. It's been my supposition that it's largely due to the lack of public health infrastructure there. Other folks are arguing or claiming that you have a younger population, and also these 54 countries in Africa did legitimately work together to decrease the likelihood of transmission. The CDC director in Africa, Africa's version of the CDC, they call it the CDC, has been incredibly active in making sure that the continent has come together. All 54 countries have come together to really provide excellent preventative measures to prevent the virus from transmitting in Africa. But I still believe that we're going to start seeing spots of Africa light up. But when we're looking globally, what we are seeing here is we're starting to see the highest number of cases ever. I mean, this has been going up and up, and we're just seeing more and more. I look at yesterday we had it didn't show it here because it's 166,000, but this is well over 200,000 cases, right? We're still strongly approaching 300,000 cases that were documented just in the last 24 hours. And you can see the day before that broke the record, and you can see the day before that almost met the record. So we are still very, very, very hot when it comes to coronavirus. You can see over 14 days that there's been an increase in 8%, and in terms of mortality, there's been an increase of 6% as well. So you can see that shown very nicely here in this graph right here. Coming locally here to the US, again, we're looking very likely that 10% of the country has had it. These numbers do not reflect that at all, but what we do know is we're rapidly approaching almost 8 million cases with, as of yesterday, 217,857 deaths. Last night, we added 56,652 cases and almost 1,000 deaths. What's unique here is that the US makes up 20% of global cases, although we are literally 4% of the global population. So there is a significant disproportionate number there. When you look at the country as a whole, look how the country is just on fire with coronavirus. I mean, it's every time I look at this graph, it changes every day, but every time I look at this map, I'm just stunned by it. I'm stunned by how, and again, the dark red is uncontrolled spread, which you see all through here, through the northern part of the country, in the Midwest, and then through the South, or it's trending poorly. Those are the only, and then through, the West Coast with Washington, California, and a little bit on the Northeast as well has been doing pretty well. But for the majority, I think 38 states right now are either trending poorly or have uncontrolled spread. And we are seeing that the number, these states, particularly North Dakota, South Dakota, Wisconsin, Montana, and Utah are really on fire with COVID. But when you look at the curve here at the US, you can see, Doc Griggs and Eric and I argue, was this really a second part of this, or is this a second wave? Are we entering a third wave? It's really hard to say. And in fact, it's hard to say that when you're in the middle of an epidemic, and usually these things are really looked upon, in retrospect. I think this was all one wave right here. And I think what we are doing now is what we are seeing is an uptick in cases. We know that Florida just completely opened up, and we'll be looking at data indicating how bars and restaurants are the major driver of this virus. But in particular, what we are seeing is an uptick in cases, significantly so. And when you have the governor of Florida, I think Rick DeSantis is his name, now also say that the football stadium, they're going to fill their football stadium for 60,000 people completely without any restrictions whatsoever. These are the things that are going to start driving the number of cases up. And we'll talk a brief minute about super spreading events, because we will start seeing them. Sturgis was an excellent example of a super spreading event. You had 500,000 people contribute to 250,000 new cases of COVID. That has now encompassed 62% of the counties in America. And of course, the most famous super spreading event is happening right now in Washington, D.C. Now, if there's good news, the good news is that we are seeing a remarkable decrease in deaths, and that's largely due to the fact that we are seeing younger people getting COVID right now. doctors were getting a lot smarter about how to treat COVID. And then, of course, we are seeing the use of dexamethasone, or these steroids, have been tremendous in helping to fight the body's overreaction, if you will, to COVID, which is called ARDS, or acute respiratory distress syndrome. That's how people were typically dying of COVID. But now that the use of these generic, very, very cheap and very plentiful steroids have been incredibly useful and helping. Some of the other, remdesivir, it doesn't really have an effect. It lessens the number of days in a hospital, but it's really the steroids that have been really very, very, very successful in the hospital in the treatment of COVID. And again, as I said, it's doctors also being we're a lot smarter on how to treat. So I was asked to talk a bit about how to keep the radio station clean, and so I just want to do that by briefly just looking at data, kind of as to help you understand how to keep your station clean based on the most up-to-date information that we have. So one of the big things in the beginning of the epidemic was this sense of everything, wash your hands. Well, I'm an infectious disease doctor. I love hand washing, right? I've built my career on hand washing. I've gone and visited the inventor of hand washing, Ignaz Semmelweis, at his hometown. We pilgrimaged there to pay honor to him, because before there was a time where people didn't wash their hands, and it took an OBGYN and obstetrician to basically tell people to wash their hands. So of course I'm a big fan of hand washing, but there was a obsession with people, not bringing the mail in and packages and all this stuff, and it was really, over. This is a respiratory virus. We just need to be very clear about that. But fomites is essentially the technical term for anything like a phone or a can of a cold drink. So we refer to that as fomites. And so people were very obsessive about washing their hands and or washing packages down. And in the beginning of the pandemic, when I got interviewed by journalists, one of the very first questions I would always get is, what do you do? How do you bring in your mail? How do you bring in your shopping or your groceries or what have you when you make groceries or your packages? And it's like, I don't know. It never even dawned on me, right? It was just I was watching this theater around me, but I bring in my packages, I open it up, I take it out, I throw the package away, and then I wash my hands afterwards. For takeout food, we just bring the packages in, we take the food out, we throw the things away, and we wash our hands. So as a result of that, other physicians or scientists also started to, sorry guys, I just got a text and I need to go back to where I was. Hang on one sec, I'm so sorry. I tried to quiet my text here.
No, because they're just, one thing I know,
There we go, thank you. So when we talk about transmission dynamics, it really affects, there's multiple factors that go into play here, right? And what we've seen, and what I'm going to make the argument is that being indoors with poor ventilation is single-handedly the most successful way for viral transmission. So we're going to make that argument in just a moment, but we need to recognize that those individuals that are older and that may be immunocompromised or have other multiple comorbidities are at great risk for severity of illness. What we've seen more than anything else, and this is something that I talk about all the time, and in fact I'm writing a book about this, is talking about healthcare inequities, especially when it comes to race, misogyny, trans, and homophobia. And what we've seen is a significant, and what COVID has done has ripped the Band-Aid off of a gaping wound of 400 years of social inequities. And so we are seeing that those individuals from communities of color and those that are at the poorest or at the lowest rungs of the socioeconomic ladder are disproportionately affected as well. And then of course you have super spreading events or events where one individual is responsible for multiple cases, and we'll go into detail about that. But what I did want to show you really quickly is that it's just looking at 3 of the best studies that were done at hospitals. So this was done in a hospital in which they basically went and swabbed 16 surfaces where in an isolation ward for COVID-19. And what they found was that there was no SARS-CoV-2 RNA. In other words, they went, they swabbed, they didn't find anything on any of the surfaces that were high touch. Okay, well, that's one study. This is another study that was done in Spain, and they did it inside an infectious diseases ward or a COVID ward. And what they did is they collected 26 samples looking for, again, for the virus. But what they did is they did find a couple of samples of virus that was on a part of a respirator. But what they were able to do is they went to try to culture it, and the virus was not culturable. And if the virus is not culturable, if you're just finding the virus and pieces of the virus, particles of the virus, okay, that's one thing. But what you want to make sure, if it's really bad, is you want to make sure that it can be that it's live virus. And what we were finding are pieces of dead virus. And so here what they did is they found pieces of dead virus. They went to try to culture those pieces of dead virus. They didn't know they were dead. They went to culture it, and they found that the virus was not culturable. So in other words, the virus is dead. And then this is the last study, also looking at, they found 94 swabs, 26 were positive for RNA, and what they found was that none of it was culturable. So what, in summary here, what we're seeing essentially is that we do find on fomites pieces of virus, but that virus is not culturable. And if it's not culturable, that means it's not transmittable. So what does this mean? So in the next section, I'm going to make an argument as to how much transmission is related to the respiratory route. But cleaning precautions with a disinfectant on a routine basis is adequate to keep you, your family, the station, and its inhabitants safe. I don't think gloves are necessary. I do not walk around with gloves. I wear gloves when I'm in the hospital, of course, and I'm examining a patient or what have you, but not on a routine basis. I just keep hand sanitizer around, and we do that pretty regularly. And then we keep the station clean, and we'll talk about that as well. And again, like I talked about, I usually get questions about what do you do with groceries, mails, packages, takeout, whatever. I just do everything the same as I've always done. I've never really changed my routine about anything. And again, here are 3 studies that basically support that as well. So what do we do at WHIV? So the first thing that we did is we shut the station down because we were considered an essential. Job or an essential service in New Orleans. We were allowed to stay open. The radio stations were allowed to stay open. So we only had 1 person in the station at the time. And to this day, we still only have 1 person in at the station at the time. We ask that individuals wear masks all the time when inside WHIV, and they also put a clean sock over the microphone. So we have everybody have a mask on as well as a sock over the microphone. Of course, we ask that hands are washed before and after, and then we also ask that folks disinfect the station after they're done. We had a production booth. We completely closed it up as well, so that's locked up. And at first, folks were still doing things at the station, so we actually had to go through and remove all the microphones. And so there was only 1 microphone now active at the radio station. So everything is pretty much closed off. Then we started a very aggressive campaign to wear masks. So this is Don P. is our morning DJ, has a morning show. This is Jenny Yanez, who has a show called Islam in the Crescent City. And I'm very happy to say that David Duke trolls us pretty regularly because we have this radio show called Islam in the Crescent City. Jenny does not mind me doing this. She loves it. In fact, we actually have a hate page on WHIV on our website. Every time we get hate mail or what have you, we put it up on the website. We wear it like a badge of honor, and I wear this like a badge of honor, that David Duke trolls us pretty regularly because we have Jenny Yanez, who's a traditional Muslim woman, have a radio show show called Islam in the Crescent City. I told you that WHIV is based on the principles of atheism. I lied. I have one exception. Our one exception is we have a radio show that's dedicated to Islam. She prays on air. She talks about her life and what she does, and she's now becoming a very influential activist here in New Orleans. I'm very happy to say that. And Sam Price here is one of the most famous musicians in New Orleans. One of the nice things about WHIV is we were able to bring in a number of musicians who are DJs, and so we're very, very privileged to have that. We had folks that donated masks, so we actually created a clean and a used bucket here, and then we have folks that go in and wash the masks. One of the things that I tried to do is we had a radio station, and I really wanted to focus on using and harnessing the power of the radio station. So we created a campaign called Mask Up, COVID Down. And as a result of that, that went with an open letter that I wrote to New Orleans musicians to please support public health messaging. New Orleans is built on music, and there's no music or nightlife right now. And so there is a lot of talk on social media. In fact, I was never a big social media person to begin with. I really had to step away from it because a lot of the talk, I understand these musicians, if that's all they do, they don't have an opportunity to make money. And it's terrible, of course, obviously. So along with this Mask Up, COVID Down campaign, that was a video, it was a song, along with asking musicians to please support public health officials in their messaging, and to start a campaign of masking and taking pictures of themselves masking up. And so this is what this campaign is musicians all over New Orleans taking pictures of themselves being masked and supporting public health messaging. These are some stills from the video, and this is Lily Lewis. And so essentially, Lily has a show on WHIV, and this is me singing. I'm a musician as well. I play bass. And so I asked Lily one day if it's like, I've got this idea for a song, and she's like, I've got this idea for a song. And so she just went and ran with it. And what I'm showing you guys here particularly is that when we filmed and when we recorded this song, we did it over 2 days. It was more expensive that way, but we did it separately. So you'll see that we were each individual in the studio. So instead of having everybody at once, which is typically how a song gets mostly recorded, you can see that we were all individually in the studio recording. And then the producer just layered one element on top of the other until we had a final song. And then the video was recorded that way as well. And I love this picture right here of playing a sousaphone with a mask. I think that was just for the sake of taking the picture. So what we are also doing too is I also wrote this op-ed called "A Mask for 28 Days Can Help COVID Go Away." This op-ed went viral, and the idea here is that the incubation period of the virus is 14 days. In any sort of pandemic or epidemic setting, you aren't usually clear of the virus unless you go through 2 cycles of the incubation period. So that's how you get to 28 days. So this was the op-ed that I wrote, and what happened was some friends and some colleagues took the whole idea of 28 days, and we are now writing a second song. So here is a second song. I am sure they would freak out if they knew I was showing you guys this. This is not. This is going to probably come out on November 1st. Yeah, here it is. November 1st, this will be released. It's called 28 Days, and this is some stills from the video off of that as well. So the ability of having the radio station and using the radio station to create positive messaging and then also have it go viral has been very important as well. As an infectious diseases doctor who also is the executive director and founder of a radio station, I really tried to use both, and a musician, tried to kind of take all of those talents and put it into some positive messaging. So that's what WHIV has been doing. Probably the most important thing to talk about, I think, right now, and the thing that we hear the most about, is aerosolization of COVID. So I wanted to give you guys my thoughts about that. The thing that is, the poor CDC, I think that the CDC and the FDA have been purposely denigrated. Messaging from them has purposely been denigrated by as part of the terrible federal response, and we'll get into that. But some time back, I think it was about a month ago, the CDC finally acknowledged aerosolization of the virus. And in the next slide, I'm going to explain what these terms mean. So I promise you, I'll tell you what those technical terms mean. So they finally acknowledged aerosolization of the virus. And then 2 days later, they took it back. And I think that was under duress and under pressure. We've all known that this virus is aerosolized. And how do we know that? There's no way that there would be such transmission. This virus is highly, highly transmissible. And there's no way it would be as transmissible as it is if it weren't aerosolized. So what does all this mean? What's the difference between droplet, aerosolization, and airborne? So let's talk about that. Give me 1 second. Excuse me. So droplets are the things that come out of your mouth that are big. These are things that you see. Somebody sneezes, they cough, they accidentally spit on you. Those are called droplets. And the virus lives in those droplets, as you can see here, right? So you can see here's the droplet. This is mouth mucus, or what's referred to as spittle. That's where the word spit comes from. And it's just basically, it's the mucus, and then the virus lives in that mucus. Now, these things are like bowling balls. Think of them as bowling balls compared to these airborne droplets, which are, or particles rather, which are like more like BBs. Okay, so we're talking about, think about a bowling ball, think about a BB. And so these things drop out of the air very quickly. They drop out of the air about 3 feet. So that's where the whole 6 feet comes from. And initially it was thought that coronavirus was a droplet because other coronaviruses are carried through droplet particles. But what happens is that as the droplet leaves somebody's mouth, let's say, right, this mucus, and if it's aerosolized, in other words, if it catches a drift or what have you, or if it's sunny, or if it's warm outside, or if the conditions are right, the mucus can desiccate. Desiccate means dry up. So the mucus can desiccate, and now what you have is a smaller droplet that forms, and then ultimately what you end up with is just the virus itself, right? And then the virus itself is just airborne, and that's what we refer to as aerosolized. So just like a bowling ball falls out of the air very quickly because of the gravity, because of its mass, you can see that a BB being a lot smaller, having a lot less mass, is not affected by gravity. And so that whole thing about 6 feet, that's gone. That's gone, gone, gone. Do not consider 6 feet as being a safety factor. And I'm going to show you data that supports that. I will also say that yesterday, my colleague, Doc Griggs, Eric, sent me and I meant to put it in here, but I didn't want to, as I was actually building this slide right here, he sent me an ABC news post saying that the CDC, again, kind of reneged on this whole idea of aerosolization, but I think, again, that they're being bullied. And we know well that it's been documented that the White House does bully. The CDC has bullied the CDC in the past, and the FDA as well. So I would not, it's hard for me to say the words I'm about to say right now, but I would not trust necessarily everything that comes out of the CDC, especially when they flip-flop. If it's something that's like, whoa, that's kind of weird, you know, like, oh, it's aerosolized, and then they take it back, believe the first comments, don't believe the take-backs. All right, so how did we first start learning about coronavirus? Well, the first one was a choir practice that happened in Saskett, Washington, right? Saskett County, Washington. And essentially one person infected almost 87% of all of the cases. So you have your index case, you have your choir practice, and you have a massive super spreading event. And so one of the things that we are now starting to learn with coronavirus is that one person is likely to, a minority of individuals, and this is a truism in infectious diseases, where a minority of folks are responsible for a majority of transmissions. So if you have COVID, even if you don't have COVID, you may be a transmitter or you may not. If you may have COVID and be a transmitter, for example, I'm in quarantine right now because against my better thoughts, I went to a face-to-face meeting. I wish I hadn't gone. It was for a nonprofit I'm on the board of directors for. And even though we were all masked and we were all very socially distanced and we were in a room that was very well ventilated, the next day, one of our board members, sent us an email saying that she was positive. So I got a rapid test this morning, 5 days later, as you're supposed to do. Fortunately, mine was negative. But the key here is, am I worried about that I may get COVID? Not likely, because again, you have a minority of people who are responsible for a majority of transmissions. And I'm going to show you that in just a quick moment. But here, what we do see is one person in a choir practice, so singing loudly, we recognized was a problem. This was a case where you had your index case right here, A1, transmit these were family members. So everything in red were positive. These were family members, right? So we don't know, they traveled together. So they may have gotten COVID from traveling. But it's the C1, the C2, the B1, the B2, and the B3 that are much more interesting. They were seated way, way, way further apart than 6 feet apart, right, as you can see. And the idea was that it possibly was this air conditioner that was transmitting the virus. So again, a droplet couldn't do that. The only way something like that could happen is if it was aerosolized. This was a study that just came out just about 2 weeks ago. It's a fascinating study about how this woman here, this is the index patient, IP's index patient, got on a bus in China. They were Buddhists, and they were going to a Buddhist ceremony. So there was 2 buses. This was before masks were mandated, before there was a lockdown in China. And she had just had dinner 4 nights before that from somebody from the Hubei province, right, which was the center of the outbreak. But you can see here that so anything that's not white, that she transmitted to, right? She transmitted virus to all of these people while seated on a bus. And there's no way, again, that would happen. The people who didn't get it were more likely to be seated next to a window, right? Or seated next to a door. So ventilation is important. We're going to get back to that. But again, aerosolization is the only way that can explain that. This is, I apologize for the content of this slide, but this is a study in which a family transmitted virus to 2 families above them. Right, the only link was, and we saw this with the SARS virus in 2003, was through the epidemiologists went in there and they investigated and they found that the plumbing system were all linked, and that was the only link from this family that transmitted to the family here, and then that transmitted to the family above. So they put in some dye, and they showed that dye actually leaked into the 2 other plumbing systems. So, can stool transmit a virus? Yes. And can plumes, so toilet flushing, potentially transmit virus? Yes, we've seen that. And again, that's aerosolization. We've seen it before with SARS-CoV-1. This was the study that, when this study came out, I was like, done and done. This is aerosolized. No one's going to tell me otherwise. This individual, essentially, they set up these air traps, right? These air filters. And they were able to capture live virus that they were able to culture and replicate from 16 feet away. So this whole thing, idea of 6 feet, no. Don't consider that at all. The CDC also just recently released some really elegant studies showing that if you ate at a restaurant within the 2 weeks prior to that, you were 2 times more likely to have gotten coronavirus. And if you went to a bar, that went up to 4 times. So 400% likelihood of getting coronavirus from going to a bar 2 weeks prior. So bars and restaurants are particularly problematic. This was a study that was done prior to COVID, but the authors are they're in the process of release. They put a press release out. They haven't actually put the paper out, but they were trying to show this for influence. But what they were doing is they showed that there are people who talk louder transmit more virus, right? So talking loud, laughing, singing, right? This sort of stuff, shouting. This is why football games and soccer stadiums or what have you, live sports, we can't, these are, there's other studies that I did not put here in this deck that show that in the UK, before the UK shut down, anytime there was a football match or a soccer game, there was significant increases in transmission of virus because of the shouting, the screaming, the hugging, the fellowship that happens at a game. So loud talking increases the likelihood. This was a fascinating study because what they did here in these 2 communities in Germany was they allowed kids to go back to school. They didn't mask them, but what they did is they ventilated the classrooms really, really well. And there was a significant decrease in viral transmission. There's no way that a study like this could ever be replicated in the US. I would never recommend doing something like this because for me, masking, it's all about masking. But what they showed here was that ventilating rooms was really, really important. So that's something to consider as well. And I'm sure you guys all saw this very important work that came out of the Washington Post that basically looked at what happens when a community opened their bars again, or a state opened their bars. So every time a bar got reopened, boom, cases went up. Every time a bar got opened, boom, cases went up. And you can see that this is in the shape of the US. So they very cleverly mapped out, including, our huge outbreak that happened here in Louisiana, our so-called second wave after bars and restaurants reopened. And this is a great picture of two people talking. This person is breathing, and you can see the plume of their respiratory contents. But look at this person who's talking, and look how large that plume is. And you can see why it's important to mask as well as stand as far away from people as possible. So bars and restaurants, people lean in to hear, right? They laugh, they sing, you can see how viral transmission happens. It's impossible to drink while somebody's wearing a mask. So this is why bars and restaurants are all over the country linked with increases of cases. This was a study that was important for many reasons. And essentially, one is that it happened in India. So this was the first study to look at a low or middle income country. But this was a huge study. They looked at 85,000 cases. And then they went and they tracked down and tested 600,000 contacts. This is a huge, huge study. There's a lot of takeaways from the study, but the thing that's the most important was that 5% of those that transmitted virus account for 80% of transmission. So it's a small number of people who transmit the virus, and that was one of the very, very important takeaways from the study. And then lastly, just to wrap up this section real quickly here, was I get asked all the time, what about the Black Lives Matter protests? What about the protests? What about the protests? So in short, did protests transmit virus? No, they didn't, actually. And this was a huge study that was done. And what actually, it's really fascinating. So what happened? So in every community, in every city where there was the protests that happened during the springtime and early summer, what these folks found using data, publicly available data from the CDC and cell phone transportation data, was that wherever there were protests, the protesters drove people home. People stayed home at greater numbers during the protest, right? They didn't want to be caught up in the protest, the traffic, what have you. And in doing so, the Black Lives Matter protests actually helped to prevent transmission by keeping non-protesters at home. So, and then the protesters themselves actually were masked, they were outdoors, and so there was little to no transmission at all. Real quickly, just talking about masks. Masks are very important. Please, please, please. This was a study showing what masks work. Of course, the N95s are very important, as are the surgical masks. But what the study found was that just homemade masks work as well. The things that don't work, though, are these vented masks or these valved masks. Those are like somebody's not wearing a mask at all, because remember, the purpose of the valve is to let the breath out, and then the fleece don't work. In fact, the fleece was actually worse. It actually took the droplet particles when it went through the fleece material, and it made them smaller so that they were more aerosolized. And then probably the most famous study of all, or the thing that at least for me, why I think this is such a powerful case study here, was in Missouri. After the lockdown ended in Missouri, that you had two hairstylists that went back to work. And when they went back to work, they were both, unfortunately, they both had COVID, and they were both symptomatic with COVID. They should have stayed home, but they didn't. There was 139 clients that they exposed as a result of that. These two hairstylists were masked the whole time, and their clients were masked. the state health department went through and evaluated all of their contacts, including the 6 other hairstylists that worked in the same salon, and they found that there was 0 transmission of virus. So at the point of peak viral transmission potential with these 2 hairstylists, just the act of wearing a mask, both from the hairstylist and the person getting their hair styled, prevented transmission of virus. I'm gonna just skip these slides real quickly, just so I can continue on. Just to let you guys know, these are studies that look at respiration, and what they found was that these masks, what are they called, the face coverings, or the face shields rather, transmit virus very, very effectively. So that is not a good protection. And this is an example of a valved mask as well. So you can see that it's not keeping in the contents of the respiratory system. So I believe that factors for transmission include being indoors, poorly ventilated rooms, being unmasked, loud speaking, and then I think it's aerosolized. I personally avoid being in rooms with anyone that's unmasked, including a valve mask. I don't eat indoors at restaurants. We eat sometimes outdoors, maybe. I never step foot into a bar at all. Sporting events, no way. Music venues, they're not happening right now. If they're outdoors, yes. In fact, I'm going to be playing, one of my bands is playing on October 23rd in an empty bar that we're just streaming music. It's going to be streamed on WHIV. It's also going to be streamed online, and it's just a way to help keep musicians doing their thing. And of course, I avoid valve and fleece masks as well. So just the second part of this talk is really focusing on misinformation and looking at misinformation. Here you can see a graph I'm sure you've seen many times. This is Europe's outbreak, and this is the US's outbreak. You can see Europe went up and then very, very effectively treated their coronavirus. Of course, they're having a second outbreak now. But you can see we never actually did, right? We just continued on. We're still seeing far more cases. And just to break it down, largely, this was a large, major failure on the federal government. They didn't act early enough in mobilization of federal response. Lessons were not learned whatsoever. Communications were unclear, inconsistent, and most often politicized. Testing and tracing were needed. You can see here Korea and the US had cases on the same day. I think it was like January 19th or January 20th. Korea ramped up their testing. We didn't, and you can just see the difference there in terms of cases. The federal government has completely underinvested in local preparedness. All public health systems in the U.S. are completely broken, and this certainly COVID-19 has shown that. And the federal government underinvested in local preparedness. Their U.S. stockpile is non-existent. There's complex and opaque globalized supply chains, and global and national surveillance and monitoring of the epidemic is lacking significantly. So when one of the things that we have seen now is this whole idea of an infodemic. An infodemic was something that was coined during the SARS-CoV-1 or the SARS outbreak that happened in Asia in 2003. And essentially an infodemic is just basically a blend of information and epidemic. And what we have seen, unfortunately, is in this very elegant study that was not peer-reviewed, just to let you guys know, it's not a peer-reviewed study, so it's waiting to be peer-reviewed. But what the authors did is they looked at more than 38 million articles that were written about the pandemic during January and May. So they found 38 million articles, more than 1.1 million of them included misinformation, and that mentions of Trump made up 38% of the overall misinformation conversation, making the president the largest driver of the infodemic, with miracle cures far and away, blowing away all the other misinformation that we have seen with the epidemic. And I was going to go through all of these. These are all just examples of misinformation. I'm going to skip through some of these slides right here. I was going to just comment on them, just how how misinformation is just terrible. Has been very, very harmful for us with respect to transmission of the virus. These next set of slides are really looking at how governments are responsible for transmission of virus. And this was a study that was done and that looked at 169 countries. What they found was that the mortality rate was higher in countries that did less testing per capita, that had less hospital beds, and that had less effective governments. And more of these studies are coming out, and the US is showing up on more and more of these because of the just gross lack of preparedness, and really the plan of action was essentially inaction. Just to also just kind of help you guys blow away some facts, some misinformation facts. There are multiple studies that show that the coronavirus lockdowns did indeed slow the pandemic. And what this study shows here in multiple different countries, that anything that's on this side of the bar means that it was effective. And you can see all of the countries here. So you can see they studied almost 2,000 national and local stay-at-home policies. And it was found to be very, very helpful in slowing down the virus. Another study looking at 11 European countries, and they found that lockdowns were significantly effective in slowing down viral transmission, more so than some of these other interventions. Sorry. And then also we hear a lot about face masking potentially and can cause an increase in or exposure to carbon dioxide. Obviously, that's not a thing. You can ask any surgeon who's done operations for more than 5 hours, 10 hours, 20 hours that wear face masks. And so the pulmonologists actually went out and they actually did a study, and they actually showed, yes, indeed, when you wear a face mask, there is no increase in carbon dioxide. So that is another misinformation that you can blow away. As I'm starting to wrap up here, I just wanted to talk quickly that those that are most likely to be susceptible to misinformation are Gen Zers, which is really, really something that I've got parents. I see what they say. I thought my parents were susceptible to misinformation, but here's a study showing that the Gen Z generation, so 18 to 24, were more likely to believe in misinformation regarding COVID-19. Where was I? Sorry. There we go. And then lastly, vaccine hesitancy also persists amongst communities of color, and that's largely due to misinformation as well. And of course, as I said, I'm writing a book. Part of that book is really reflecting on the legacy of Tuskegee and the syphilis experiments in Tuskegee. So we understand why communities of color are hesitant. Again, it speaks to the importance of continuing to fight misinformation. So I told you there was going to be 2 plugs. Here's the second plug. Part of what we did to help fight that misinformation, not only do we have a daily show that we talked about, but we also have a daily podcast as well called Noise Filter. And a Noise Filter is, where did I not put it? Yeah, it's on AudioPort. So you can see here we have it's 10 minutes of information. You can see here 10 minutes a day when we filter the COVID-19 news through the lens of social, economic, environmental, and racial justice. Again, you can find it. We have 2 versions of it. We have a 10-minute version of it. And then we also have an hour version of it. And the hour version just basically takes all the 10 minutes shows and kind of clumps it together into a 1-hour show. And I just put up some of these ratings here that are there. One of the things I did want to talk about real quickly in my last couple minutes is that here I saw these ratings just last night for the first time. I actually had never seen it. But what they did say, I was really happy to see. I'm so happy that you talk about the toll it's taking on so many people, including you. And Doc Griggs and I have been very open with our health and mental state going through the pandemic, as our days are 14 to 16-hour days, usually for the first couple months, 7 days a week. So we talk openly about how, including ourselves, how important it is and how mental health is important. This group in Stanford called Life in Quarantine is a global project in which they're collecting stories from all over the world, found us and wanted to partner with us. And now what we do is we have folks read their own stories and we as to what their life has been like in quarantine. And these beautiful stories from all over the world being read, and we feature them on the podcast as well. So my summary thoughts here on misinformation is that fighting misinformation is as crucial as fighting the pandemic. Please, please, please use the resources at your disposal to help us beat this pandemic. And the federal plan of action is inaction. So it's up to us as broadcasters to be the purveyors of truth for COVID-19. And this occurred to me somewhere in June. I feel like I was slow, and I should have recognized it in April. But the day that I realized that, oh, there is no plan, it was the day that I was kind of the first of some emotional breakdowns that I had when I realized that there is no national plan to fight COVID-19. So as broadcasters, what we can do is fight the misinformation that comes from it. I just want to bring your attention that the IDSA, which is my society, the Infectious Diseases Society of America, and the Brennan Center for Justice did put out some guidelines for voting. You can find it at the Brennan Center for Justice. And essentially, if this is something that may be useful for you locally. So you have basically infectious diseases doctors that basically sat down with these guys here and said, here's how you do safe elections. So if this may be a potentially helpful resource for you. So I just kind of wanted to spend the last minute just talking about kind of what the future of radio looks like. And here in Louisiana, we are in the process of our 6th storm coming in right now. And again, as I'm looking outside, I'm seeing the winds and the beginnings of rain. We definitely have a tropical storm coming in. I can see it coming in right now. At one point, we had 5 named storms in the Gulf, and it really forces me to kind of think about, what do you do with a radio station that floods regularly, right? We now have we have a volunteer who lives nearby the station. He doesn't even ask for permission. He'll just text me. He's like, should I close the station? Yeah. And then because he lives so close, he'll just go in and he sandbags the whole thing down, protects the station. But what do we do with something that floods regularly? Now that recently the FCC has allowed for stations to not have a physical location, I'm being challenged to why even have a physical location at all. As I see the future of radio is, being disaggregated content delivery more than anything else. And there's arguments on both sides. Having a station makes it, a place, makes it official, and people get together or whatever. But what does that look like post-COVID? I mean, do we really want a place? I don't, the same thing that got us to COVID-19 could get us to COVID-22. Who's to say there isn't going to be a COVID-22, right? Do you think that when this is over, this is going to go away? I don't think so at all. I don't see human behavior changing at all with respect to how we got to COVID-19, which is largely due to humans moving further and further into areas where they're exposing themselves to these fruit bats, and that's where the coronavirus lives, and also influenza lives with birds, and they're in places and areas and forests as they're deforesting and accumulating more land, that puts them at greater risk for exposure. And that's how these things, these pandemics, pop out of areas like South America or in the Far East as well. So the idea of COVID-19, could there be COVID-22? Could there be COVID-27? What have you? And the idea of having disaggregated content delivery, so people doing things at home, I think it's still a little ahead of its time. I think that the software is just starting to make it so that we'd be able to access our automation system. So if you have a show on Monday night at 6 o'clock, you'd be able to do it from home. You'd have a Zoom, or you could have somebody there at your own house. But I as an infectious diseases doctor, I'm challenged by the idea of having a place that will bring people together, as I think that this will be going on for a long time. So with that being said, I can't tell you enough how pleased, what an honor it is to have been asked to speak at this conference. And I did want to also open it up to see if there was any questions or anything that I can do. Please feel free to reach out to me anytime.
Wow. Thank you very much. That was amazing. Incredibly informative and thorough presentation. There are some questions in the chat, and maybe I'll just, instead of reading them, maybe I can just call on people or something like that. So WAYO Radio, can I just unmute you, or can you unmute yourself and pose your question? I'm not sure. This is my first time. I think
Yeah, can you hear me?
Yeah.
Okay, cool. Hopefully there's not too much echo. Yeah, so my question was sort of around, we basically are leaving a 15-minute gap between transition between shows so that the first show can leave and the second one can come in. And then we also put, MERV 13 filters, which seems to be the standard in our HVAC, and then also put in a bipolar, like needlepoint ionization generator into our AC unit. Is there still concern? Is that 15 minutes not enough? At the moment, we're saying when you're seated at the mic, you don't need to be masked. And obviously we have capacity restrictions. We have a pretty large studio and we're limiting to 3 people, and we have plexi shields and stuff like that. But, what does that sound like to you? And then sort of secondly, does that needlepoint ionization stuff, have you heard anything about that?
Yeah, I don't know anything about that. I'm just starting to learn about the MERV things as well. And Eric, I used to be an HVAC person, so which is convenient because Doc Griggs teaches me these things about the MERV rating. The HEPA filters are likely to be a thing. I don't know for 100%. My sense is that it's probably better to possibly have them. It certainly could do no harm. I would not have anybody in your radio station that would be unmasked. That's my opinion. Everybody in our station, again, the best way for me to answer it is just the way that we're doing at WHIV. Everybody's masked, and the microphone has a sock on it. Period. End of discussion. And if they don't do that, they lose their seat. I have a waiting list, a mile long of people that would love to have a show on WHIV. So, and again, we have only one person in the radio station at a time. So without knowing your specifics, and without knowing, kind of being there, and feel free to take down my phone number, and I'd be happy to chat with you if you want to take me on a virtual tour of your radio station. I'm happy to kind of help you kind of, find ways of being safe. But just for us and our perspective, one person at the station, always masked, even when they're by themselves, always with the sock on the microphone. Because the thing is one of the things that we don't know is, and I guess that you're asking about the 15 minutes, and I think that that's great, but we don't know how long the virus can potentially remain airborne. And that's a thing. Now, if you've got, good circulation, there was that study in Germany that I showed you that showed that ventilation is incredibly important, right? That's what that study taught us. They were unmasked, but they really focused on ventilation, and how important that ventilation is can't be underestimated. So if you have really good ventilation, we don't have very good ventilation. It's New Orleans, right? It's an old building that is subject to flooding. So it's humid, it's moist, with terrible ventilation. So for us, it was really easy just to kind of focus on just keeping one person masked at all times with a glove, with a sock on the microphone as well. And I think that those are the important things. But again, take my information. I'd be happy to reach out to you and take a virtual tour of your radio station. But thanks for asking a great question.
Cool. Thank you so much.
There was a follow-up here about socks. Are you talking just about like a sock that you put on your foot, or is it a special microphone?
Yeah, it's like a sock you put on your foot. Like these things we couldn't find them for the longest time. So because we couldn't find the microphone covers, we just we ran around the city as lockdown was happening, and going to a music shop, trying to find or order them online, and we just couldn't order them. So we just finally decided we're gonna just put socks. So you come to the station with a clean sock. Please make it a clean sock and just literally put that sock over the microphone. And it's been working successfully. People have been really, 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 really adherent to it. People have been great about making sure, they take pictures of themselves and they will Facebook Live. And it's just, it's been working out great for us.
All right, thanks. Bennett Cobb, do you want to ask your question?
Hey, this is a fantastic presentation. Quick question of the recent news I've seen that gargling and nasal lavage with saline are supposed to be fabulous. Also, any comment on vitamin D and COVID? Thank you.
Yeah. So the gargling and all that stuff doesn't exist. I would not waste your time with any of that. This is a respiratory virus. So that you're going to gargle, you're going to do nasal lavage, maybe at that moment, maybe, but like 5 minutes later, you're now exposed again. So that's not helpful. Vitamin D is an interesting question. I didn't actually put it on this slide deck. I do actually put it on other slide decks. And just to give you a quick comment on vitamin D, a quick little historical perspective. In the early 19th century, in the 20th century as well, or the turn of the 19th into the 20th century, TB sanitariums were all built. And if you go to a TB sanitarium or an old building and you learn, oh, this used to be a TB sanitarium, what you'll see is that they have huge windows. It's a wall of windows facing west. I did my residency in Cleveland at Case Western in Cleveland, and the apartment that I rented, the first apartment I rented my first year, had this huge balcony. And the balcony was almost bigger than the apartment. And I remember asking the building groundskeeper why. And the groundskeeper said, well, this used to be an old TB. This was a home for people with TB. And they would live outside. So TB doctors back in the day knew that living outside was helpful for tuberculosis. So now flash forward 150 years or so, what does that mean? What did those doctors know? Well, what they knew is that sunlight helped respiratory infections. And so how do they do that? Well, sunlight obviously is what builds up vitamin D levels in humans, right? And so vitamin D is important for something called macrophages, and macrophages are part of the immune system, and macrophages are part of the immune system that literally they're like little Pac-Man, right? That eat, that gobble up, right? And they literally find viruses or bacteria and dismantle them. Those are called macrophages. So the TB doctors knew something. They knew that sunlight helped people with TB because it was helping to kill the TB bacterium. So now how does that work with COVID? Well, there's a fascinating literature that's coming out now that really does show, and I really believe this is the case. I never bought into the big vitamin D thing over the last 10 or 15 years. I have a very close friend who believes that everything is vitamin D oriented. He's a doctor, and really he's super into vitamin D. That's not my jam whatsoever. But what I am finding here in the literature is really, really fascinating that yes, indeed, there does seem to be a link between those people who are vitamin D deficient and having higher severity of illness. So does that mean that we should all take vitamin D? I don't think so. I did see the first editorial in a medical journal that did say something along the lines of we should start taking vitamin D supplements. That was the first one. It was an editorial, it was an opinion piece, it was in a medical journal. But I think that we are going to start seeing more information that says, yes, indeed, that vitamin D deficiency may be linked to severity of disease. Now, does that mean that's going to prevent you from getting COVID? No, it's not going to prevent you from getting COVID. But if you do have COVID, it may be the thing that could potentially decrease the likelihood of severity. So last week, what did we learn about the president? We heard the president got a dose of vitamin D, a dose of zinc, a dose of vitamin C, aside from the Regeneron that he got before he went to the hospital. Why did they give him that? Well, the vitamin D is because of what I just told you. The vitamin C is completely useless. That is non-existent. The vitamin C does not boost the immune system, and that's that. I know that people think that it does. It doesn't. And then why the zinc? The whole purpose of the zinc is interesting, and I'll tell you why, because it'll lead to something else that we've talked a lot about, and that was hydroxychloroquine. So after the SARS-CoV-1 outbreak, right, the one that happened in 2003, scientists saw that hydroxychloroquine dismantled the virus inside a cell. So they were like, wow, okay, that's kind of cool. This malaria drug dismantles the virus once it got inside a cell. And that was that. That's all that was. But for these scientists to get the hydroxychloroquine into the cell, they needed to use zinc to literally push the hydroxychloroquine into the cell. That was benchtop research. That was research from like 15, 16 years ago. That was it. That was the only thing. They never actually took that and put it into clinical trials. They did now, but the whole thing with zinc was that the zinc pushed the hydroxychloroquine inside a cell that may have had an effect on the SARS-CoV-1 virus, which is different from the SARS-CoV-2 virus. So thank you. That was a great question.
All right, guys, we're gonna have to wrap up. We have another session starting at 3:15. Dr. Dery, thank you very much. There's been a number of people asking for a copy of the PowerPoint.
Okay.
If it's possible, we'd love to get that and distribute that.
Absolutely.
Thank you, and we'll see you all at the next session.
Thank you guys so much. I appreciate it.